The goal of this session is to provide a basic awareness about dyslexia, the legislation surrounding it, and the district procedures and guidelines. Dyslexia is a specific learning disability that is neurological in origin. It is characterized by difficulties with accurate and/or fluent word recognition and by poor spelling and decoding abilities. These difficulties typically result from a deficit in the phonological component of language that is often unexpected in relation to other cognitive abilities and the provision of effective classroom instruction. Secondary consequences may include problems in reading comprehension and reduced reading experience that can impede growth of vocabulary and background knowledge. These reactions are understandable because most of us are reluctant to do things that are difficult. Sally Shaywitz, one of the major researchers of dyslexia, reminds us that dyslexia is an island of weakness in a sea of strengths. We must recognize the student's strengths and abilities and capitalize on them. Knowing that students with dyslexia have many strengths can help us to focus on how to improve their weaknesses with the phonological components of language. To maintain the fidelity of a dyslexia program, educators need to be aware of the laws surrounding dyslexia. One of the ways to guarantee fidelity is to download a copy of the 2018 Dyslexia Handbook and have it easily accessible for persons who need it. The most recent handbook is available on the TEA website, the Region 10 website, and in this year's District Dyslexia folder. The first three codes relate to compliance monitoring, educator preparation, and continuing education. The others relate to students, including reading diagnosis, student advancement, screening and treatment, classroom technology, PEIMS, and assessment. Other codes, including the Texas Occupations Code and the Texas Administrative Codes, are listed to assist in recognizing the different laws that relate to accommodations, provisions for practitioners and therapists, and state board rulings. Recent legislation requires screening for students in kindergarten and grade 1. Other legislation focuses on assisting students with avoiding retesting and providing accommodations beyond high school. Texas Education Code Section 38.0031 needs more attention because many are not aware of the technology tools that are available for students. It will be helpful to review this information on the Region 10 website so that you can assist students who can benefit from the use of technology. If students do not use technology to assist them on a daily basis, it will be difficult for them to use it for assessment purposes. Keep in mind that practice makes permanent. Another fact to consider is that the students listed as having dyslexia in PEIMS should be the same students who are enrolled in 504 dyslexia interventions. This information is important for those individuals who enter RTI data for reporting purposes. To be a person with a disability within the meaning of Section 504, the student must have an impairment that substantially limits a major life activity, such as caring for one's self, performing manual tasks, walking, seeing, hearing, speaking, breathing, learning, and working. Learning, reading, and writing are all major life activities. Therefore, a student with dyslexia or a related disorder may be considered to have a disability within the scope of Section 504 if the condition substantially limits the student's academic functioning or other major life activity. The determination to refer a student for an evaluation must always be made on a case-by-case basis, and decisions must be driven by data. A team of persons with knowledge of the student, instructional practices, and possible service options meets to discuss data collected and the implications of that data. These individuals include, but are not limited to, the classroom teacher, administrator, dyslexia specialist, and/or interventionists. This team may have different names in different districts and/or campuses. Most of our elementary campuses call it the SNAP Committee. This committee of knowledgeable persons is not an admissions review and dismissal or R committee or a Section 504 committee, although many of these individuals may be on a future committee if the student is referred for an evaluation and qualifies for services and/or accommodations. The SNAP committee must rely on the data in order to make a recommendation about the student's identification. This information is shared with the ART committee or the Section 504 committee to assist the appropriate committee in making the most appropriate decision about the student. Keep in mind that the typical student with dyslexia will have difficulties that result from a deficit in the phonological component of language that is often unexpected in relation to other cognitive abilities and the provision of classroom instruction. When a student is characteristically low in all areas, other avenues should be explored, possibly specially designed instruction that meets the unique needs of the child based on the disability. After the committee of knowledgeable persons makes a recommendation based on the unexpectedness of the student's difficulties, the Section 504 or ART committee must then determine if the student has dyslexia. For English language learners, an LPAC representative should be included in the Section 504 or ART committee. The questions listed must be considered when making a determination regarding dyslexia. The identification and intervention process for dyslexia can be multifaceted and must include qualitative and quantitative data. Data gathering is the first step of the process, and you can see that it is important to look at numerous data points, including progress monitoring, information from teachers and parents, and samples of student work. The following is a checklist of procedures for ensuring compliance with state and federal laws and rules. Please notice that parental notification begins the process. In addition to teacher training, districts must also provide training for parents. The information about the parent meeting will be available on the district website, and letters will be sent to parents. Oftentimes, we try to schedule the parent training during the month of October when there is a focus on dyslexia. In compliance with IDEA and Section 504, test instruments and other evaluation materials must meet the following criteria: used for the purpose for which the evaluation or measures are valid or reliable, tailored to assess specific areas of educational need and not merely materials that are designed to provide a single general intelligence quotient, selected and administered to ensure that when a test is given to a student with impaired sensory, manual, or speaking skills, the test results accurately reflect the student's aptitude, achievement level, or whatever other factor the test purports to measure, selected and administered in a manner that is not racially or culturally discriminatory. As we continue with IDEA and 504 compliance, note the additional criteria: multiple measures of a student's reading abilities, including anecdotal records, universal screenings, progress monitoring, and classroom observations, administration of the testing completed by trained personnel, and testing conducted in the student's native language. What is important to remember is that we must use valid and reliable instruments that are research-based with documented evidence to support the findings. When assessing students whose first language is not English, it is important to involve the Language Proficiency Assessment Committee or the LPAC. One of the first items to consider is the home language survey, which helps to identify the student's dominant language. Please note the pattern of evidence for the primary characteristics of dyslexia, especially as related to the unexpectedness based on age and cognition. Some areas needing our attention include reading words in isolation, decoding unfamiliar words accurately and automatically, reading fluency for connected text, and spelling. Other decision points mean examining the data extensively. Notice that this slide reminds us to look at underlying cognitive processes, including deficits in phonological or phonemic awareness, a family history of similar difficulties, rapid naming, orthographic processing, phonological memory, verbal working memory, and processing speed. The note on this slide reminds us that previous effective instruction in phonological or phonemic awareness may remediate skills in isolation. However, this does not indicate that transfer has occurred. As a result, the student might not be ready or prepared to perform in a regular classroom, void of the scaffolding that normally occurs with remediation. This slide demonstrates that there are two paths for identifying students with dyslexia, Section 504 or IDEA and the ART Committee. Please note the continued appearance of the word unexpectedness when looking at this decision point. The final decision point relates to Section 504 and ART Committee decisions based on the Texas Education Code, Section 38.003, and the Texas Administrative Code, Section 74.2A. These factors capitalize on information related to the student receiving appropriate conventional instruction, appropriate academic progress, average ability to learn, and lack of progress associated with language differences, irregular attendance, or experiential background. Carrollton-Farmers branch is working diligently to provide adequate instruction for dyslexia students by implementing the multisensory teaching approach, or MTA, which is a kindergarten through 12th grade program designed to be completed within a 2-year period, possibly 2.5 years. This slide demonstrates that at one time we used the ILIT program as a reading intervention to serve as a stopgap for secondary students until adequate numbers of middle and high school teachers are trained with the MTA program. During the summer months, we trained 18 additional teachers to assist with implementing the MTA program at the secondary level. As a result, secondary campuses will need to transition to MTA as the instructional program for dyslexia and use ILIT as a resource for struggling readers. The 2018 Dyslexia Handbook negates the use of computer programs as instructional programs for dyslexia. One of the reasons that teachers are very careful in making a determination about dyslexia is that it is a lifelong label because it is not a disability that comes and goes. The purpose of the multisensory teaching approach, or MTA, is to provide students with tools to assist them with becoming improved readers. Students learn skills that help them to become skilled readers. When students exit the MTA program, ongoing monitoring is important, especially the first year. Monitoring may include, but is not limited to, the collection and/or evaluation of progress reports, report cards, state assessment data, map data, and other reports. One of the resources not listed on this slide is the trained personnel on your campus. Always begin with the person who is most knowledgeable about dyslexia and its characteristics, either the dyslexia specialist or the instructional facilitator, who has been trained to implement the MTA program with fidelity. Other resources listed include the Texas Education Agency, Region 10 Educational Service Center, the International Dyslexia Association, and the Texas Center for Learning Disability. Please check these links as needed. Overcoming Dyslexia by Sally Shaywitz, one of the leading dyslexia researchers, is listed as one of the books that we have provided for each campus. It is imperative that we rely on accurate information about each child rather than rely on myths that we have heard over the years. Reversing letters does not make an individual dyslexic. Dyslexia is not a vision problem, and every student who struggles with learning to read is not dyslexic. Let us continue to work together to unlock the code so that every CFB student will become a proficient reader, writer, thinker, and problem solver. To ensure that we help our students, every campus needs trained personnel to assist with identifying and serving our students with dyslexia. This thinking is aligned with our belief that all children deserve a quality education and that CFB is here to serve all of our students.